Joining us now is Dr. Bob Lahita. He's a professor at the New York Medical College and chairman at St. Joseph University Hospital. Dr. Lahita, we love when you join us. Thanks for being here. Now, you just heard that little boy Hudson. It's heartbreaking to hear him ask Dr. Fauci those questions. I know there's a lot we don't know, as Joe just said, but is there any evidence so far showing how long some children may be dealing with the impact of having COVID? And really, is there any chance that they could be COVID long haulers even into adulthood?
Well, Savannah, I think that is a possibility. We simply don't know what causes this long haul syndrome. But mind you, in immunology and rheumatology, we have seen patients with something everybody's familiar with, chronic fatigue syndrome, which is myalgic encephalitis. That's what the formal term is. And we always wondered what the cause of that might be. And that is exactly like what we're hearing in the long haulers. We're hearing shortness of breath, fatigue, can't get out of bed, can't function, can't write, can't think straight, nausea that's persistent, and so on. So now we're beginning to see it in children, and that is worrisome. And it would indicate to me, now this is only my theory, that the immune system continues to linger on thinking that the body is infected, and it persists. And over time, it will go away. But it may take 6 months to a year. And in addition to that, we have been trying with various medications that we've used in some of the autoimmune diseases to try to control this long haul syndrome.
Dr. Bob, let's now switch over to states reopening, because I do want to ask you about Texas and Mississippi and the decision there to lift all restrictions, including mask mandates. Now, with millions of people no longer being told they have to wear a mask, Texas on its own is a huge place with a lot of people who are going to travel in and out of the state. How much could this set the U.S. back as a whole?
Well, I think it's a big mistake to give up with mitigation at this early stage. First of all, we haven't hit herd immunity, which means it's unsafe to go out into crowds without wearing a mask and without social distancing and washing your hands frequently. I would, for example, never not wear my mask in my office with all of my patients, even though some of them have no symptoms whatsoever of COVID-19. So I think it's a big mistake, and I hope that we're keeping careful records in Texas and the other states that lift the mask to find out whether there's a bump up, which I expect there'll probably be. There'll probably be a bump up of several thousand new cases as soon as this mandate is lifted.
Oof, that is not good to hear. Dr. Lahita, also with President Biden saying there'll be enough doses for the entire adult population by May of the vaccine, what do you think summer and fall could look like? I mean, is that when we could see it being appropriate potentially to lift some of those restrictions?
I think that would be the appropriate time. Once we have what we think is herd immunity, and we're getting closer and closer every week to herd immunity. And herd immunity, remember, is when the population, the large amount of the population is vaccinated, or you have people who have been infected. So if we get to 70 to 80% of herd immunity, then we will be able to drop all of our masks, and we will still have the COVID around, but we're not going to have the kind of severe disease that we're seeing now.
And Dr. Bob, let me ask you also in terms of restrictions, some that are a little bit less dramatic, like a mask mandate, but we are seeing even places like here in New York, indoor dining open up to a certain capacity. Would you be comfortable eating indoors right now?
I don't eat indoors right now, and it's largely because my wife does not like the idea of going into a closed space without a lot of ventilation. So I've been eating in tents and yurts for the past 6 months. So if I'm a barometer of what you should do, you should not probably go into a closed space without ventilation. But that's not to say it's not safe, because they do have plexiglass barriers, and they have other means such as social distancing to keep us protected when you're indoors. But I like a place with ventilation now, and I think still I would wear the mask, and all of the waiters usually wear masks, and they're very, very careful with hand washing and using antiseptics.
Dr. Lahita, those yurts are tough to book. Those go quick. So you guys are on your reservation making. Thank you, as always, for joining us.
Thank you.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.